Today, I have the pleasure of talking with Dr. Craig Sammet, President and CEO of Blue Cross Blue Shield Minnesota and a Greater MSP board member. Thank you, Craig, for taking a few minutes to talk to the Greater MSP region about what you're seeing and doing and what you expect to see around the corner.
My pleasure, Peter. Good morning. Hope all is well and safe with you.
Things are good, and you as well?
Excellent. Thank you. As best as we can be in this crazy, sad time.
Yeah, exactly. Well, by way of introduction, you're the CEO of Blue Cross Blue Shield of Minnesota, and that's a familiar company to many in this region, but maybe not to all. Could you give us a sense of the size of Blue Cross Blue Shield and the role that it plays in Minnesota's health system?
Sure, happy to. So we're a $13 billion nonprofit here in Minnesota. We've got nearly 4,000 teammates, predominantly based in the Twin Cities, although we've got offices in Virginia, Minnesota, Duluth, and various other places through our retail clinics where we are a health insurance and diversified business that's proudly served Minnesota for nearly 90 years. I think what people didn't remember, right? Most of us didn't remember, we weren't around, is that we were the very first Blue plan in the nation. And we're now the largest health plan serving Minnesota.
Wow. Well, what has the COVID-19 crisis meant for Blue Cross Blue Shield? How has it affected your business and your priorities?
I think it means everything, sort of both in the near term and the long term. It's been surreal, unprecedented. I talked about us being around for 90 years, but we've never in our history had a pandemic in the course of our history. And obviously this is a first for all of us. So I think we're learning as we go day by day and really focusing on our values and our heart and our mission. Because at the end of the day in crisis, that's what matters more than anything else. Our priorities are probably quite similar to everyone else in Greater MSP. For us, it falls in three dimensions. We want to focus on keeping our associates safe. We've had a very intensive focus on well-being in all respects, and it's not just physical. It's professional, it's social, it's behavioral. We were a really early mover to get people home. But we've also focused on job preservation and doing everything we can to keep our team spirits up.
Not easy at this time.
No, harder than you would imagine, and I'm sure we'll talk about that a little bit more. But our second priority is keeping our customers healthy and secure. Now isn't the time for patients, for members to worry about insurance continuity or the cost of healthcare. Now is the time for us to all rally to support people in need. And then the third priority for us is assuring that our organization and our provider partners, which we worry about, weather the storm and that we all emerge stronger, not weaker when this is passed. And that we all keep an eye on how we can become a different and better system that learned from the crisis. So I'd say those have been our priorities in the last month.
Well, let's touch on some of those. And there's so much going on in the healthcare system right now. From where you sit, what data or specific issues are you paying closest attention to?
I guess the simple answer would be everything, but I sort of bucket it into three categories: today, tomorrow, and the day after tomorrow, if that can help. The today issues and data is really about focusing on the things that get in the way of care for the people we serve. Is there ample access for care? Are we testing and treating without out-of-pocket costs? Are we removing the bureaucracy of healthcare, of health insurance? Do our hospitals have sufficient capacity? Can people get through via telehealth? Is our community accessing basic needs? We've been very keen on reinvention of the healthcare industry, and one of our intense focus is on health inequity and social determinants of health. So we can't forget that, yes, while we're focusing on keeping people healthy, are people getting access to food? Are people safe in other ways? And so that's our today strategy. The tomorrow strategy is we're sort of worried about the immediate after effects of the crisis. In particular, I'm most worried, especially wearing my physician hat, about our provider partners. Are there ways we can pay claims faster? Are there ways to pay providers payments that would normally come later in the year so they don't have liquidity concerns given a drop in elective procedures? How can we use our leverage and our scale and our size to help providers access equipment and personal protective equipment? We're also kind of in the tomorrow strategy looking at the emerging sciences. What is the utility of antibody testing? What's the effectiveness of temperature screening? Can we integrate our data safely and securely with other sources so that we can safely return to work and prevent recurrence of the virus? So those are the tomorrow things that we're thinking about. And then the day after tomorrow is, we're also looking toward the future and keeping track of the clear weaknesses in the healthcare industry that have been exposed through the crisis that we can learn from, and that we can pivot to a better system. If there's any silver lining, it's my hope that this crisis leads to a fundamental reinvention of our industry. There's a lot of healthcare in the country, and we already cost twice as much as other developed countries. So the quote that comes to mind for me is, the future's already here, it's just not evenly distributed. And this crisis has really highlighted that. How is it possible that we can cost so much as an industry and yet see the gaps that we've experienced through this crisis, whether it's insurance gaps, care delivery gaps? If we come out of this crisis and we see healthcare premiums rise, if we see ongoing health inequities, if uninsurance or underinsurance worsens, or if we go back to the old ways of either insuring Americans or delivering care, then I view that as yet another tragedy on top of the tragedy we're already experiencing. So those are the things that we're focusing on from a today and tomorrow and day after tomorrow perspective.
Well, and that was where Blue Cross Blue Shield was headed before this crisis. You were looking at transformation. You had those issues in view. And I guess it's encouraging that you see a potential path to that, but I mean, how real is that? And what are you able to do, or what could the others in the system do to actually make that pivot and drive towards something better coming out of this crisis?
I saw this great quote just in the last couple of days that in these trying times, it seems as though we've never been more alone and yet more together. And I think that's what we can do. I've always been a believer that the current players in the industry are the ones that can sort of hold a mirror up to ourselves and transform. And we don't have to wait for a shock to the system. This has certainly been a shock to the system, but we shouldn't have to wait for legislative change. We shouldn't have to wait for disruptive innovators to change us. The hospitals, the doctors, the health plans have kind of always had an ability to think about change and to drive change. I've wanted telehealth to have its day for decades. And we've either thrown up obstacles against it, or the incentives haven't encouraged us to use it, or we as patients and customers haven't tried it. We've been reticent to try healthcare from a distance, so to speak. But I think now we're getting a taste of it, and now we shouldn't go back. We should go forward, and whether it's changing the payment relationship between payers and hospitals and doctors, or whether it's loosening restrictions for working at the top of our license, or whether it's accessing care in different ways, I think we have the power to change all of that.
Well, uh, you're a CEO and you're an internal medicine physician. How has that influenced how you're interpreting and experiencing this crisis and this time and this potential change in healthcare?
Uh, it's, I think the cognitive dissonance that kind of comes with me historically wearing the hats as a doctor, as a business person, have never been kind of more real for me
Hmm.
than right now. You know, as a physician, and as a, you know, a child of an older parent who's in New Jersey, who I worry about.
Hmm.
I'm inclined to say, you know, let's do everything possible to keep our members, our patients, our community safe, recognizing that that means, you know, economic sacrifices. And yet, on the other hand, as a CEO, I understand the imperative to jumpstart our economy and preserve jobs and recognize that sort of coming back too soon poses risks to a vulnerable community that could get sick. Um, so I struggle, as many do, with the challenge of that trade-off, and you know, how to balance the risk of kind of the short-term impact of the virus on health relative to the longer-term impact of a poor economy and unemployment and food insecurity on health. And so this is a real difficult choice. You know, that said, I've never been an extremes type of leader. You know, I don't see those options as mutually exclusive, and um, you know, I believe that we can support the health and safety of the community by walking a tightrope, and that there's a path forward that allows us to come back to life and keep people healthy at the same time. Um, and so I struggle. We're looking at that. You know, it's even to play a leadership role within our own community. How do we come back as an organization, and yet you know, proudly keep all of our associates healthy and well? And I think that's the struggle in the role that I have and the hats that I wear, in finding the right way to achieve that balance.
Well, and that's what everybody's talking about now. Obviously, we have to focus on saving lives, and then it's, you know,
Right.
protecting livelihoods. And you've kind of combined both of those priorities very much in your story and your background, your day to day.